Good afternoon, and thank you for being here. Welcome to Sam Houston State University's COVID-19 Town Hall, Fall 2021 edition. It's been a long 18 months since the pandemic began, and we've made great strides together as a campus community. However, as the pandemic continues, we recognize SHSU faces many challenges, including new variants, uncertainties, and even misinformation. We hope this town hall addresses some of these issues and answers the questions that you've submitted. My name is Rhonda Biesi, and I'm the Associate Vice President for Human Resources and Diversity. And I'm your town hall moderator. Answering your questions today are an esteemed panel of experts. More than that, each panelist is a member of our campus community and the COVID work group. They meet multiple times a week, review volumes of information, and lend their expertise to help the university address COVID challenges. Let me introduce them. First, we have Dr. Drew Miller. Dr. Miller is the Associate Vice President of Student Affairs, Executive Director of Counseling and Health Services. Dr. Miller also serves as chair of the COVID work group and czar, because I like to keep that term. The other panelists in alphabetical order are Ms. Erica Bumpers, and she's the director of the Student Health Center and Office of Health Promotion. We have Dr. Ann Gilliard, interim vice provost for academic affairs, and she's a cell biology scholar. Finally, we have Dr. Candace Walkley, and she is a practicing physician, an assistant professor of internal medicine and infectious diseases in the Department of Primary Care at the College of Osteopathic Medicine. As a reminder, we're following the same question and answer format used in previous town halls. So we're going to address the most frequently asked questions or expressed concerns. And in some instances, we may combine like questions in an effort to answer as many questions as possible. So with that, let's begin. The first question goes to Dr. Miller, and it reads, having recently come from an institution mandating masks and vaccines, I'm dissatisfied with campus-wide COVID prevention efforts. I understand that some of the issue is the governor's executive order, but does SHSU have any other plans to stop the spread of COVID on campus beyond the measures currently implemented? Drew?
Great. Thank you, Rhonda. So I actually really like that we're starting with this question first, because I think it really speaks to what a lot of us are feeling right now, which is so much concern and quite honestly frustration at the current landscape. So I wanted to acknowledge that, because we on the working group sometimes feel frustrated by what we're able to do or not able to do while we're trying to do the very important work of keeping our campus a safer place to be. And so I also want to acknowledge that we're at a time of heightened polarization around COVID and how best to respond nationally at the state level, certainly locally. And so I also want to acknowledge that I suspect some of our answers today might not be satisfying to everybody, because we have some people who think what we're doing is already too much, and some people who want us to be doing more. And so what we want to do is just be able to speak accurately about what's happening so that we can all make informed decisions moving forward together. So having said that, one of the things I really want to point out is that we are operating in a completely different environment than we were last fall when the semester started. So if you recall last year, there were still several state level restrictions in terms of what could happen, business capacities, et cetera, and a lot of those things had relevance to campus as well. At this point, though, the state is completely open, and we do have some pretty significant legislative limitations about what can happen on campus. So of course, everybody knows about the mask mandate, that we're not in a place where we can require masks on campus at this point in time. We also know that at this point, vaccines can't be mandated. Even asking about vaccine status as it might relate to accessing a service, which ends up being a pretty broad definition. And even most recently, contact tracing at the state level was shut down and moved to the county level. And there was a provision put in the state budget that said essentially dollars appropriated from the state budget couldn't be used for contact tracing over the next biennium. So it really does put some limits on what we're able to do here at the university. Now, having said that, there are many things we can do and continue to do. Most importantly, continuing to make the vaccine available. We want to make sure we can get as many members of our community vaccinated as we possibly can. You'll hear more about why that's so important coming up, I think. But that becomes critical. We continue to make testing available in multiple formats because, again, knowing your status so you can make informed decisions about quarantine or isolation is really essential. We just recently found out that we may be in a position to implement some vaccine incentive options, which is something new and we haven't been able to do before. And so we're looking at how we might be able to do that in the upcoming weeks to encourage even more vaccination as the semester goes on. And then we've taken steps already to make sure it's easier to connect to the CDC guidelines about how best to keep yourself safe with current regional information about community spread. And so those are just a few of the steps of things we're doing to make sure we can keep campus as safe as possible.
Thank you, Drew. This next question is going to be for Dr. Walkley. Although I got vaccinated, the virus is mutating and the vaccine is not very effective. How can I protect myself from going to campus?
Okay, so this is a great question. This is a question that I get asked every day that I do clinical work by individuals just worried about the vaccination, and especially with the Delta variant, whether or not the vaccination is going to provide them any benefit at all. And a lot of people say, why should I even be vaccinated if it doesn't seem to be working against emerging variants, or what we call strains? And so I think it's worthwhile to stop, to back up for just a second and understand a little bit about vaccinations. There are different ways we can vaccinate individuals depending on what effect we're trying to get. And the vaccine that we have for the SARS-CoV-2 virus is it induces what's called humoral immunity. That means we give it to you in the arm, and it goes into your bloodstream, and it induces antibody in that environment. So what it doesn't do is induce what's called mucosal antibody very well. And so mucosal antibody is where we would actually deliver the virus directly to your mucosal surfaces and then try to encourage antibody formation there. And the reason that's important and distinguishing is because if your mucosal antibody is your first kind of barrier of defense. And so when we are giving a immunization that results in humoral antibody development, we know that we may not prevent some of the mucosal infection, and that's okay. We accept that that's part of the long-term potential complications, if you will, of the vaccine. What it means is that some people are still going to get symptomatic COVID. And we've known that from the very beginning in the phase 3 clinical trials, where we had, about 10% or so people still come down with COVID with symptoms, but they never did get sicker than that. And so when we say the vaccine's not effective, I think we have to qualify that. Okay, and we qualify it into three categories. We say, is it effective against symptomatic mucosal COVID infection? That's runny nose, cough. Versus, is it effective against hospitalizations? And is it effective against fatalities? And overwhelmingly, it is effective. Greater than 90% reduction in hospitalizations and fatalities, even with the Delta variant. So it's a very, very good and safe vaccination to protect you from severe COVID disease. Now, as far as Delta and actually symptomatic COVID, it's not as good as the original wild type strain, but it's about somewhere between 60 and 80% effective at reducing symptomatic COVID. But what we do know is that if you get the vaccination, even if you get symptomatic COVID, you're very unlikely to have much more than a little sniffle infection. So it is a very good vaccine. It does protect you when you come on campus, and it protects other people. Aside from vaccination, are standard mitigation procedures. So wash your hands, Don't come to school if you're sick. Stay away from sick people. And if you are very at risk, an N95 mask is very protected for you.
Thank you. Thank you very much. I appreciate that comprehensive response, and I know we all do. And so since we're talking about the vaccines, there's a lot of talk about booster shots. So I'm going to ask Ms. Bumpers, will the university be offering booster shots?
Thank you, Rhonda. So I want to start by just clarifying the current recommendation for those who should get the booster shot. And so the ACIP, which is the Advisory Committee on Immunization Practices, and they provide guidance for the CDC recommendations that we are following. So the current guidance for the third dose or the booster shot is for those that are moderately or severely immunocompromised. And so when we talk about that group and what we're going to be offering here on campus now or in the future, all of our future vaccine clinics on campus, I've now partnered with the Department of State Health Services. So the Student Health Center and the Department of Health will be working together to provide vaccinations. This has done some really good things for us. It's given us more manpower, which we realized when we were doing mass vaccination at the Student Health Center early on, that more manpower would be a good thing. It's also expanded the vaccine that we can offer. So right now within the Student Health Center, we do still only have the Johnson & Johnson vaccine, but with our partnership with the Department of Health, we're going to be bringing Pfizer and Moderna to campus. And so in our vaccine clinics, our first round, the Department of Health is actually going to be this week. So Wednesday and Thursday of this week at the library. For those that are currently in this category, defined as moderate to severe immunocompromised, they may get that third booster dose at this event on campus this week. And as I talked with our partners at the Department of Health about that, they indicated that that would be a process as they're registering, that they would ask some questions to gather that information, and they would be able to offer that if they fit into that category. And then we can also offer a second dose. So if you've already had your first dose somewhere else, but you want to get your second dose here on campus this week, we can offer that as well. One of the main things they asked is for anybody that's going to participate in our campus events is that they bring their original vaccine card so that they will have the information about the vaccine you received and the dates that you received it to review when they're doing your vaccines. And then as far as future third dose or booster shots, if it was a recommendation just for the general public, that would come out later after it's been reviewed, then the Department of Health has committed to me that they could come back on campus. Most likely it would be around the November timeline to offer those booster doses for the general public if that becomes a definite recommendation through the CDC.
Thank you, Erica. Appreciate that. It's exciting of all that's coming up this week. And the partnerships that our Student Health Center and other members of the COVID team, Dr. Williams, have created with the state and with our county. So thank you for that. This next question goes to Dr. Miller and Dr. Walkley. We're going to ask, I think, Dr. Miller first, and that is, will SHSU ever consider mandating the vaccines? The university already requires certain vaccinations, and recently the FDA approved the Pfizer vaccine. Go ahead, Dr. Miller.
Yeah, so I actually get this question quite a bit, and it tends to be in relation to the meningitis vaccine. So everybody knows that in the state of Texas, students have to have the meningitis vaccine before they can go to school. That's actually based on a state law, and then how that law was enacted is sort of overseen by the Higher Education Coordinating Board. And so that gives us that authority. Counter to the meningitis vaccine, currently, of course, we have a prohibition in place against mandating any COVID-related vaccine. Now, originally, the limitation to that spoke specifically to any vaccine that was developed under an emergency authorization. And so then when the Pfizer vaccine specifically got its full FDA approval, everybody thought, well, great, now we can mandate that one perhaps. But then, of course, there was a follow-up to that legislative action with the new executive order that said any COVID-related vaccine, regardless of FDA approval. So essentially, it kind of throws cold water back on that idea. But the long story short, at the end of the day, we continue to monitor the legal landscape related to vaccines in the state of Texas. And as that landscape changes, we'll sort of look at current conditions and then make the appropriate recommendations to campus leadership.
Thank you. Dr. Walkley, did you want to speak to the FDA approval of Pfizer and whether, that would ever be something that might be required?
Well, when we were looking at these questions and discussing how to think about them, we really look at a lot of these questions from different perspectives. And so one of the things we want the audience to understand is that mandating a vaccine may not actually be the best thing for everybody. Because if you mandate a vaccination and there's only one that's FDA approved, then that's the vaccine you end up mandating. And it's not actually necessarily best for every patient to get the Pfizer vaccine. So as an infectious diseases doctor, I have 3 vaccinations to choose from. And I actually do have I like this one for this situation, and I like this one for that one, and I like Moderna for immunocompromised people because it's there's a longer duration in between and a higher dose, and it results in a little better immunogenicity than the others. And so I have reasons why I might pick one over the other. And so it's really not best for everyone if we mandate you to take the one that's FDA approved. So that's part of our thinking. And so we just want the audience to understand that not only do we have these executive orders to deal with, but we're thinking about what's really best for the groups as a whole from a medical perspective.
All right, thank you. This next question is for Ms. Bumpers. The self-administered rapid antigen test kits are an excellent resource for our students, faculty, and staff. Thank you for offering these. How long will these be available? Will other testing protocols be in place at the Student Health Center? Erica?
Yes. All right. We are very excited about the self-testing kits as well, and happy to announce we had a span of about 3 to 4 to 5 days where we had a delay in having them, but they are back and we have a good supply on hand. And so our goal, honestly, is to have these available at least through the end of this semester. As you can imagine, there's a very high demand for this over-the-counter test, not just here on campus, but even in the general community. It's hard to find them sometimes. So supply and demand challenges is what we're facing right now with this particular testing platform. What I've been able to do is I'm actually working directly with Abbott, who is the producer of the test, to procure a standard weekly shipment. And so I'm trying to set up an agreement with them where we get a certain number in every week to keep that flow going. Obviously, it's going to sometimes be hard to judge what the demand is going to be. So how many people are going to come in and get them that week? We have a couple of programs that we're doing a more defined testing with, so allocating to those programs. But we are definitely going to try, we're going to do everything we can to keep them on hand. And I will say if we know that they're going to be unavailable for even a short period of time, we will do exactly as we did last go around and try and get that out through as many avenues as possible, whether that be the newsletter or social media, to say, we're out right now, but here's when we plan to have more. So right now we're fully stocked. I did a little show and tell. So this is what the test looks like. My wonderful pharmacy staff also put a little QR code sticker on there. So if you test positive, they've made it very easy to self-report to the university. You just scan that code and it takes you right to the self-reporting portal. As far as other testing, I just want to touch briefly on what we're doing here at the Student Health Center. So yes, we actually have all testing platforms here. We honestly have from the beginning. That's something that we were very strong in making sure that we got testing available here and being able to offer different resources. So right now we do have, we have this over-the-counter test. We have a rapid antigen that we use in the clinic setting. And then we also have 2 different PCR, so the molecular tests. We have a saliva-based test and also a nasal swab PCR. So we're using all of those within our clinic as we're seeing patients and students in the clinic for more diagnostic testing. I will say one of the transitions, the important transitions that we've made actually just today, so I think this was great timing to be able to share this, is that the asymptomatic screening, so you're not having symptoms and people are doing a lot of screening testing. We had been doing that through our nurse clinic here in the clinic. So students, faculty, or staff could actually schedule an appointment come in through our nurse clinic and get that testing done by a staff member, by a nurse. Interestingly, it's the exact same test that you're getting in the over-the-counter version. It's just we administer it versus you self-administer. We are shifting to only a self-administer, so over-the-counter option being available. It is free. Any student, faculty, or staff can walk into the Student Health Center to the pharmacy with their SAM ID and request that over-the-counter testing kit. We had to do that because we needed to really focus our clinical resources on visits and student appointments coming in to really make sure that we were addressing everybody as well as we could. So the take-home message is we have lots of testing, we have lots of options for you. If somebody's not sure, they can even just call the Student Health Center and we can talk them through what we recommend.
All right, thank you. That was our most enthusiastic question, but we're going to go for more. We're going to go for more enthusiasm. So we're going to turn for a minute to talk about reporting. Speaking of the QR codes option that the health center, ingenuity. This is what it has bred on our campus. COVID has bred ingenuity on our campus. But we're going to talk about reports and contact tracing, and just about all of our panelists are going to weigh in, but I'm going to start with Ms. Bumpers. And the question is, I would like an honest answer from the administration as to why there is no contact tracing and no alerts to students and instructors if a student in their class has reported a case.
All right. Well, I'm going to try and continue my enthusiasm with honesty. So yeah, I'm going to talk mostly just about our process, what we've been doing on campus, actually since fall of 2020. So I want to do a little bit of historical to really let everybody know what our approach has been. And then I'm going to pass it off to Dr. Walkley to talk about more the medical aspect of contact tracing. So I will say contact tracing, and Drew mentioned that there's been some developments and changes and shifts in contact tracing, but it's always been a very coordinated effort, whether that be through local health departments, the Texas Health Trace system, which actually went down as of September 1st, and then our regional Department of Health office. So we in Walker County, we don't have a local health department. And so one of the things that we at the Student Health Center and through our campus work group established early on was that we needed a resource outside of the county to help us navigate this. And so we really wanted to connect with our regional Department of Health. What we did to establish that relationship was Dr. Williams, who's the medical director here at the Student Health Center, was appointed by Walker County as an additional local health authority in Walker County, specifically to help serve our campus. What this did is it really allowed us, the Student Health Center, through Dr. Williams, to have a closely working relationship with the experts at the regional Department of Health office, to share data with them and for them to direct us in things that we should do on campus. And so what we have done consistently, and when I say we, I'm referring to Student Health Center, clinical staff, public health staff that works in our Office of Health Promotion, is we have on a daily basis, so 7 days a week, manned this campus COVID-19 self-reporting platform. So whether it be myself or members of my team, we have eyes on that platform, honestly, 7 days a week, looking for case reports, reading these, kind of triaging what's going to be most important and what we need to respond to. But we do respond to every case that is reported. So whether that be a positive case and we need to make sure that they understand medical protocols, return to campus policies, we talk to them about known close contacts that they may have had so that we can facilitate either them reporting, or we do have an option where if they are not as comfortable reporting that themselves, we will reach out on behalf of that person. I want to clarify, with a known close contact exposure. And so we'll get into more discussion around that. But it really has been a very structured process from the beginning. We don't call it contact tracing because it's not contact tracing. We don't have epidemiologists and other resources like that working with us on a day-to-day basis. But our goal has been to make sure that as a small group with the expertise that we have and the commitment that we have to the campus, that we're doing everything we can as far as mitigation strategies and campus response. And I just want to assure, I know it's hard for people who are not in my position and seeing that every day and knowing what's going into that. But I can assure you that this group has taken their role very seriously as far as response, and we continue to offer. I specifically offer to anyone that contacts me directly, if you have information, specific information or specific current concerns that I can help address, reach out to me, because we are open to sharing information and doing the best we can in response. So just to go back to the original question, I can't say that we've had contact tracing because we have not had that formal approach, but we have had a very comprehensive approach to serving our campus community by case tracking and exposure notifications and anything that we have the information to do that with. So with that being said, I'm going to hand it off to Dr. Walkley to talk about case notification and contact tracing from more of an infectious disease perspective.
Okay, so there's a couple of points here related to this question. So the first one is about, or one of the points I want to take is the second half of the question about why are we not recommending that all faculty notify all of their classes, and why are we not notifying every faculty, et cetera. So first is, as Erica mentioned a lot about the manpower that goes into formal contact tracing, and we don't have that. But even more important than that is that we are very careful to be very judicious in qualifying patients as true contacts. Okay, so the definition of close contact is very specific, and it means a person who breaks 6 feet for cumulatively 15 minutes or more with a known infected person. Okay, not a contact of a contact, but a known infected person. You break their 6 feet cumulatively for 15 minutes or more. So if we have a classroom where most of the students in the classroom don't break a 6 feet barrier for more than 15 minutes with another student, then that's conceivably, if you have a classroom of 200 kids or 150 students, then you may have quite a lot of students in there who don't meet the formal definition of close contact. And it's only those who meet the formal definition that are actually considered exposed. So if we send out massive mailings to everybody saying you've been in, especially considering how infectious the virus is, if we're sending these out to everybody saying you've been in contact with somebody, we wouldn't be using the accurate formal definition of contact, and thereby we would be telling people that they were at risk for things that they're actually not at risk for. Okay, so we're trying to be very pointed and directed to give the information that is accurate, not an overblown sort of a response. And that's really important because our healthcare administrative area and our whole entire healthcare system only can take so much. And so if we overblow a response and we say all of you are potentially infected when that's not really what happened, and then everybody hits the student health center, and then all of the tests are gone, but really 2/3 or 3/4 or 7/8 didn't need to be tested to start with because they weren't really exposed. Well, then see, we haven't really helped anybody. And in fact, we might have hurt people by running out of tests. So it's a careful balancing act of trying to really only deal with the truly exposed individuals, which Ms. Bumpers and the Student Health Center can do when an actual contact is reported, and then they can help that person to trace their immediate surroundings. Okay, and so that's the way that we handle that. The second point, and I know I'm sort of long and drawn out here, but the second point is about what's just happening on a global level here, and particularly in the United States, where we're moving towards immunity as a nation. So the more that we move towards immunity, either vaccinated immunity or natural immunity, we have less and less and less susceptible people. So the virus is moving. It's going to move from a more epidemic or pandemic situation into a more endemic situation, where we see the virus going to swirl around in certain populations of people. It's going to hang around in those who are susceptible. So we'll see it cropping up in little babies, and then we'll see it out there in elderly people and in people who are losing their immunity. And they may need to get boosters or whatever. But when we see viruses move like that, we move away from contact tracing because we don't have as many vulnerable people anymore. And we're not seeing as many fatalities anymore. So the whole thing, it's normal and natural for this to move in this direction. So please don't think that this is some kind of a failure on the part of your public health system or your university. This is just how things move when we start to see massive immunity, and that's actually a good thing. And so I think Dr. Gilliard is going to talk about some more additional effects of this at our local level.
So I just wanted to add a little bit about the student's perspective. And so one of our highest priorities at the university is the success of our students. And when you have a classroom of students, let's say 100 students in a class, and one of them is positive, if we were to notify the entire class, the vast majority of them would not fit that close contact definition that Dr. Walkley described. And so without knowing whether they are a close contact or not, they don't know what to do with that information. It's confusing, it's scary for them, and they may think they need to be out for 14 days. And 14 days out of all classes is significant. We don't want to have a large proportion of students who otherwise would not need to isolate or quarantine have to be out of their classes for 14 days because the academic success of those students is just so important to us. Now, some faculty have elected to use seating charts in their classrooms in order to assist the Student Health Center with better identifying close contacts. And so that is an option that faculty have. And in fact, if you're a faculty member using one of those seating charts, reach out to Erica and let her know that you're doing that. And if a case comes up in that class, she can work with you so that you all can identify those close contacts.
Right. Thank you, Dr. Gilliard. All right, we're going to have another question about the all the work that Ms. Bumpers was describing in the Student Health Center. And let me follow up on that by asking, why does the university only report the number of cases once per week?
All right, thank you, Rhonda. And you can just call me Erica, it's fine.
Okay.
So I do want to quickly, before I answer that, because it's also going to be a quick answer, but I want to reinforce what Dr. Gilliard just said. I actually love to have partners in work to identify situations. So the specific information about having a seating chart, or just another quick example, I talked to a faculty member who knew that a particular group of students had done group work that day. So we were able to easily identify specific close contacts. Please share that information with me. I will say the best avenue is by email, and I will at some point respond to every email that I get. And just, we really do value that information, and we want you to be our partners in that process if you can. So numbers reporting. We've been reporting numbers again since the beginning. And so each semester we've taken a look at how we're reporting that data and what improvements can we make. And so one of our goals that we've identified is that we want to get the most accurate data up the first time that we share it. And so as many of you may imagine, the information that I'm putting together to share with the campus community has a lot of pending timelines and results tied to it. So we're waiting on test results for a certain period of time. As students or faculty or staff report into the dashboard reporting, it does take us sometimes, 24 hours, sometimes longer, depending on how quickly we're able to make contact, to be able to contact that person, interview them, resolve some questions to know, is this a positive case? Is this an exposure? Where were they? So we're working constantly with all that information, trying to get it as specific as possible. So we did go this semester to a batch reporting approach where we are reporting at the end of the week, once a week. I really believe this allows us to take that time-sensitive information and have it as accurate as possible. Now, there are still going to be some updates that we'll even have to make to that. For instance, Friday testing, it takes us through the weekend to get results, and we have to contact people over the weekend that have reported. I can assure you that when we get new information after that weekly batch posting, I'm working directly with marketing and communications to get that updated. So that is why we went to that once a week approach, just as we continue to try and better our information that we share every semester.
Thank you, Ms. Bumpers. Also, do you want to share what our numbers look like most recently?
Sure. Put me on the spot there, no pressure. No, it's fine. And these are numbers that we are reporting. So you can go to the COVID page and see this, but we've seen some positive numbers since we started the semester. And so since our first week of reporting, the numbers are declining each week as far as our positivity rate for the cases that we test through the Student Health Center. So we actually, from last week to the week previous, cut our positivity rate in half. So we went from about 10.5% to, I believe, 4.9, right around 5%. So we're definitely seeing positive trends in the number of positive cases that we're reporting on our community.
Hey, and the enthusiasm just continues. All right, we're going to shift and talk about masks. And so I'm going to ask Dr. Miller, why doesn't Sam Houston take the highest measures to promote the safety of its students and faculty by making masks mandatory inside a campus?
Sure, and I appreciate you throwing me a question that has every opportunity to slow the enthusiasm train. So that's exciting. No, so I wanna really reinforce. So we get this question quite a bit, and it almost is a little bit of a pre-vaccine versus post-vaccine mentality, I think. So it's true. This time last year, one of the best methods we had to protect ourselves was wearing face coverings and social distancing. That's what we had because the vaccine really didn't exist yet. But now we live in a post-vaccine world, and so truly the highest measure for safety is getting that vaccine. That's the best thing any of us can do to keep ourselves safe. And to keep our campus community safe and the broader community safe. So while yes, masks still may have a role to play, this emphasis that people keep having on we need more masks, really right now that may not be the answer. So I think that's an important piece to put out there. So even before this town hall, so at the very first day of the semester, even before the Texas Supreme Court kind of muddied up the water with the face covering ruling they came out with, I was getting this question about why don't we mandate masks? It's only $1,000 fine. We should just push through at the university anyway. Need to reinforce that it's $1,000 per day per incidence. So that starts to rack up pretty quickly. But at the end of the day, our attorneys through the Office of General Counsel for the system continue to monitor the landscape. They continue to monitor everything coming out with the current rulings. And so, we keep our eyes on things pretty closely. At this point, the feedback we've been given is that the executive order around face coverings is still enforceable. And so while it's enforceable, the decision is made that we're not gonna move in a direction counter to what the law says we can do. So we'll continue to monitor, but in the meantime, again, we encourage people to do those things that we know will keep themselves safe, even beyond wearing a mask, which is getting vaccinated if you haven't done so already, continuing to test, not coming to work or school if you feel sick, staying away from other people like it's an episode of The Walking Dead when you see them sort of sniffling and walking around, washing your hands, etc. All those things that we've been practicing for the past year that we know work.
Thank you. All right, and while you're talking about the governor's order and the law in the state of Texas, if the governor's order is rescinded, will the university immediately require masks indoors? Yeah.
So again, that's going to be one of those things where we will look at what the current status of the virus is locally, what those transmission rates are, what the CDC guidelines are, and how all of those things intersect to create a safety net for our community. And so hypothetically, should that executive order be lifted, we would take all those things into consideration and make the appropriate recommendations at that time.
right, thank you. All right, we're going to pivot to talk a little bit more about our academic side of the house. And with that, we're going to feature Dr. Gilliard. And the first question is, why are we still in full face-to-face classes when there are easily 5 or more students out daily due to COVID-related issues or symptoms?
So this is something that the work group has carefully weighed. And the recommendation to be fully in the classroom is really because the university experience that our students have is so critically important to their success. The university is transformative in a lot of these students' lives. We have a large number of first-generation students, for example, and a large majority of our students don't learn well in a remote format. I mean, I certainly saw that in my classes over the last year. And we know that the very best experience we can give them is a robust classroom experience for most of our students. Last year, we didn't have a vaccine. And so we had to move a large portion of our classroom experience to a remote format. In general, this didn't work well for our students. For example, in spring of 2021, we had a large proportion of our students earn a D, F, W, or Q, at least one. And so we know that our students were struggling academically last year. They also struggled financially and emotionally. For example, the Dean of Students Office had a large increase in the number of students of concern that they saw. And so in the end, the educational mission of our university is just paramount for the success of our students. And we owe them the very best educational experience possible. A lot of our evidence shows from this last year that the best experience we can give them is face-to-face and in the classroom. And because we have an effective vaccine that is widely available, for most of our students, the risk of not being face-to-face in the classroom and interacting with other students and their professors is a greater risk than they would experience from COVID.
Thank you, Dr. Gilliard. I mean, that's why we're here. That's why we're here at Sam Houston. So let me ask you another academic related question. If an entire classroom of people gets sick, would you push professors to go into an online format for that period so they don't miss material for 2 entire weeks, or would you just let them fall behind?
So we definitely don't want students to fall behind, and professors have a variety of options for accommodating students with COVID-related absences and other absences. Professors may provide a remote option for specific students on a temporary basis, or they might accommodate a student's absence in a variety of other ways, such as take-home reading assignments or study guides. Students may not demand a remote option. That's a difference from last year. But students can expect the faculty member not to penalize them for their absence and to work with them in making up the work.
Okay. And speaking of the absence policy, we want to know what is the procedure to follow if you are exposed to someone who's tested positive for COVID-19. First, I'm going to see if Ms. Bumpers can detail any more about what is an exposure, and then we'll have Dr. Gilliard respond.
Absolutely. So, again, just to review, it's always good to share information over and over again. So exposure, just like Dr. Walkley said, we're talking about that you've been within 6 feet of a confirmed, so lab confirmed positive COVID case for a cumulative 15 minutes or more over 24 hours. And so the answer from my perspective to this question is really simple. And I think it's really simple also for our faculty or staff to share with students. If you feel that you've been exposed and you don't know what to do, we want you to self-report, okay? Even if you're not sure, you can self-report. And then when my team contacts you, we're going to ask you some questions and we're going to help you work that out. Was it a true exposure? And if it was, and we determine you need to quarantine, we're going to make sure you know how to do that. We're going to get you the documentation that you may need for your classes. So we're here to support you in that. So that is my direction. And especially I get the question a lot from faculty or even staff that have student workers, what should I tell them to do? They tell me they think they were exposed to COVID, or even if they tell you they had COVID, it's one step, easy answer. Have them go to the report portal and self-report. We actually, just as a quick side note, added that link onto Blackboard. Dr. Gilliard helped us get that accomplished. So it's visible where students are going every day for their learning. Right at the top, they can click to report that exposure, and we will help them determine what to do next. And I'm going to pass off to Dr. Gilliard to talk about some academic policies around that exposure.
So yes, if students and employees have a positive test result, or they know about a close contact exposure, they should self-report through the SHSU portal on the COVID website. And this portal is via single sign-on. So when you click on the portal, it's populated with a lot of your information already. And then some additional questions are asked that will help the Student Health Center to provide some medical guidance, as well as possibly identify close contacts. And so for students, if the medical advice is to self-isolate or to quarantine, the Student Health Center can provide an absence note that students can take to their faculty member so that they can be excused from class.
All right. Thank you all. We're going to, we just have a few minutes left, but we want to address a question that is frequently asked, and I'm going to put it out there for Drs. Miller and then also Dr. Walkley. Are there specific objective criteria for COVID-19 infections that would signal to the university administration that a change in operational status should be made?
Sure, yeah, I can start with this, and then I'll throw it over to Dr. Walkley. So again, this is one of those things where the difference between last year and this year starts to play a little bit of a role. So last year, a lot of the data we were looking at included things like the positivity rates locally, countywide, state level, hospitalization rates within our hospital trauma region, community transmission rates, et cetera. And so those were data that we were kind of poring over and then making course corrections as we were seeing things, because at that time, those data were tied to state level restrictions. And so, for example, if the hospital fill rate was at a certain level, then that meant that businesses could only operate at X capacity and things of that nature. All of that has ended now. And so one of the challenges that we're facing is that any impact we might see from campus in terms of making some of those more or less restrictive decisions won't necessarily have any net gain in affecting the outcome for the broader community in terms of keeping cases out of the hospital and in terms of reducing the cases of community spread, because the rest of the state is open. And so what we're really focusing on now is how can we make some of those decisions with the information we do have to keep our campus community and our constituents safer, whether they're on campus or out in the world. And so that's why we were doing some of the things like asking about, voluntarily asking about vaccination status through the anonymous surveys to see if we could start to gauge what the vaccination status was for our constituents. Based on that feedback, we actually have a delightfully high level of vaccine adherence on campus. And so while it doesn't get us all the way to herd immunity, it definitely does play a significant role and may be part of why we've been seeing some of those positive case rates coming down. So we'll continue to push those things out. But to the original question, specific objective criteria, we continue to monitor those things like community transmission, hospitalization rates, et cetera. But we now also have to balance that out with things like the current legal landscape, CDC guidelines in terms of vaccination status. That's of course something new. And then whatever the current flavor of the day of the virus may be in terms of how infectious or not, and what that may cause us to need to do in terms of adjustment. And on that note, I'll throw it over to Dr. Walkley because I know she has a couple of other points as well.
Well, actually, Dr. Miller did such a great response there. It's hard to say. I mean, he's really speaking to the risk to benefit ratio that you want to weigh when you're considering a massive process sort of driven interruption of some very transformative experience for students versus what the community gains when you do that. And because of the demographics that we know of the people who are being hospitalized, we can tell whether or not, because over 90% of our faculty are older people on campus, over 90% of them are vaccinated. So we know that if we change something going on in this demographic on our university, it's very unlikely to have a significant impact in the hospitalization rates locally. So these are some things that we weigh. A couple of other things just to bring to mind. There was kind of a follow-up question that we had related to this that we're asked frequently. You know, many of my students are emailing because they're sick. When are we going to go to online classes, et cetera? And so we do want to make the point that secondary education is really, you know, we're dealing with adults here. And so while you may see a bunch of primary education shutting down or threatening to shut down or considering shutting down, that's not the same response that we have with adults. So, you know, 16, 18 and younger, COVID is a different disease than in adults, particularly those over 55. So we think about things on our campus differently than you may see primary education doing. And so we want everybody to be clear-minded about that. And then the last point I want to make is that our percent positivity is dramatically falling. I mean, which, yay, that's a good thing. Bring the enthusiasm back. So, you know, 10 days ago, we were at 20%, which means for every 100 tests that we did, 20 of them were positive. Now, today, in all of the state of Texas, we're down to 13%. And I think Erica was showing our campus numbers are somewhere, you know, we fluctuate somewhere in between 4 and 9 or something like that, depending on the week. And so we're actually dramatic 4.9% most recent. So that's, you know, that's way better than the state's numbers. So that means that of 100 people who come in, and we hope they have a high pretest probability. I mean, we hope they have symptoms consistent with COVID. So if you take 100 who look like they probably have symptoms of COVID, only 13 of them in the state are going to actually have COVID. There's a lot of things out there causing runny nose and cough and sickness. And I've seen several in clinic this morning that's not COVID. So just so you understand, just because you're seeing people in your classroom with boogers and mucus and sniffling and coughing and being sick, it doesn't mean it's COVID. There's a lot of things out there, actually much more likely than COVID these days in our local area. So just because you're seeing stuff like that, don't let that make you feel like there's more of a sense of urgency. There's all of these things that we have to weigh, but the numbers are actually improving. That's going to take a little while for our local hospitalizations to catch up with that. Unfortunately, we're still at a very high burden in our hospitals. It takes a while, but immunity, vaccination immunity is the most important thing that we can do on campus to keep everybody safe.
All right, enthusiasm. Here we go. We're going to toss this question over to Dr. Gilliard. Why do we not have virtual options anymore, although we are still in a pandemic?
So what we don't have is an automatic virtual option, right? And the reasons for that, again, are that evidence shows that the majority of students don't learn well in a completely remote format. However, there are many options available to faculty to accommodate students who need to be out of the classroom. And so if a faculty member themselves becomes ill, for example, they may discuss with their department chair the option to change the modality of the course temporarily. And so, for example, in a conversation of that faculty member and their chair, they may decide that for that course, moving it to a remote format temporarily is best. It's really a local decision. Departments could also consider having another faculty member fill in and cover the course for a brief period of time, or a variety of other options that really people who are experts in the discipline would know best how to handle. The most important aspect of this is that these decisions should be made in consultation and agreement with the department chair. So faculty should not just decide for themselves how to handle an absence or a lot of students being absent, but they need to talk to their chair and come to an agreement on the best way to keep the class going while these concerns are rearing. In addition, the department will notify the dean's office. So the dean's offices are tracking changes in modality. So again, that's why it's important to make sure the chair is aware of that.
Thank you, Dr. Gilliard. Okay, so we've got less than 5 minutes and we're going to try to do rapid fire here. I'm going to see if we can throw out some questions and get some really quick responses. So Dr. Gilliard, why did athletics adopt a different quarantine and testing out of quarantine policy than the university?
So athletics currently uses the same self-isolation and quarantine policies as the rest of the university. So for the Student Health Center and athletics, those policies are equivalent. However, there is one difference for athletics, and it's due to NCAA requirements. And that is that athletes must test 3 times per week. And so they may identify more positives simply because they have more rigorous testing protocols. So as a faculty member, you may receive a note from athletics from a student athlete saying that they need to self-isolate for 10 days or quarantine for 14. And that's the same as any other student on campus. Because of the nature of athletics, it's often easier to identify close contacts among teams because of the nature of their sport. And so any identified close contacts who are unvaccinated must quarantine for 14 days like any other student, but if vaccinated, do not need to quarantine. And again, this is exactly the same as for non-athlete students. So again, instructors, if you receive a note from athletics, it should be treated as equivalent to a note from the Student Health Center because they are indeed following the same protocols.
Right. Ms. Bumpers, will staff be eligible for a free flu shot this year? And when will flu shots be available?
Yes, I get to bring the enthusiasm back and not talk about COVID for one question, which is super exciting. So for faculty and staff, our campus partners at the College of Osteopathic Medicine, so Dr. Walkley's group, are actually sponsoring faculty staff flu shots this year on campus. So they are going to come here to us. And the event for faculty staff is confirmed, and we'll get a lot more information out, but it is going to be September 22nd. And the COM students will actually be coming to campus and giving the vaccines here for faculty and staff. And then we will do the Student Health Center in partnership with the nursing program. We'll do our traditional flu shot events in the first week of October for students. So that date specifically at the end of September is for our faculty staff and is brought to us by the College of Osteopathic Medicine.
Right, I love the enthusiasm is catching. All right, Dr. Walkley, in a minute and a half, can you answer, will SHSU begin a health push and encourage Bearcats to get healthier? The stress is on the vaccine, but science proves being healthier can fend off sickness as a whole. It's not a plant, that's a real question.
This was a real question that we received, and I begged the group to please let us close with this question. This is my favorite question of all the questions, and I hope whoever asked this will come by my office and give me a hug, because this is honestly one of the most distinguishing questions of our time. And if you don't think so, you should think again. So yes, but before I answer, I want to say vaccination. I know the question said it's, we're stressing vaccination, but I do want to stress vaccination. It is effective and it is safe. Okay, I've said vaccine. As far as the rest of the question, general health and how it affects us on campus and our lives in general, and how important is it? And I want to say, I cannot overemphasize to you how much better you are going to fare across your life if you make strong choices in relation to your health. So strong choices look like paying attention to how much you sleep, paying attention to what you eat, paying attention to your weight. Don't drink too much. Let's not use any drugs, and moving our bodies. And when we do all of these things, this magical thing comes together and gives us good health where we feel good and we can accomplish great things with our body. So I want to encourage everybody to make strong, healthy choices in your life and vaccinate.
Thank you, Dr. Walkley. Thank all of you panelists. Before we close, I have to address really quickly a final request. Somebody asked about the Employee Assistance Program. I want you to know that on the Sam Houston website, you can just put that in the search bar. You go to HR and go to benefits. And they have counseling, they have a COVID resource page. There are many, many things. You can give us a call in HR if you have questions about that. But we know that campus safety, especially in this time of the pandemic, is a university-wide effort. So in addition to thanking all of you for joining us today, I want to thank you for the what you're doing, the things that all of our panelists have talked about, the preventative measures to try to keep us safe. And we just want to thank you all. Have a great afternoon.